Great, thanks very much indeed, Stephen. Fantastic. So another wonderful colleague, Stuart Bedston, is going to talk about the data infrastructure in Wales. And can I just remind you, if you've got any questions, please do put them in the Q&A. Thanks very much.
Hi, so similar to Stephen, in terms of the data sources, but to understand what's been happening in Wales, we use data that's available in the SAIL Databank. Next slide, please. So inside SAIL, there's a number of individual level data sets that've got population coverage from like the year 2000. We can see Welsh residency based off GP registration records. We've also got primary care records themselves, so attendances, prescriptions, measurements. We've also got hospital episodes, ONS deaths, and then COVID, PCR tests, LFTs, and vaccinations, which are also used by Public Health Wales. These are individual level like data sources and are routinely linked on NHS number, name, date of birth, sex, and address, and are typically covering the entire population. Next slide, please. So the vaccination data source we have covers all vaccinations in Wales or of Welsh residents outside of Wales. And we take the raw data, apply some gentle cleaning, and are quite quickly able to produce like a ready-to-use table, which we can join onto our population cohort. Like as we can see here, we can see like the different doses being received across 3 broad age groups. Next slide, please. And from the PCR test data, we can see who's getting tested and the outcome. And then from this, we can derive infections using PCR data and with or without LFT results as well, as that's in a similar structure. So for some of the work, we can define an infection as being like a positive test, for which it has been 90 days from a previous positive test. And again, we can see like just different trends across the 3 broad age groups we've got. Next slide, please. And then with the hospital admissions, if you want to look at a number of like COVID related hospital admissions, like that's been like one of our main outcomes for the work we've done. We can take hospital admissions, which are made up of 1 or more episodes, with each episode having clinical codes associated with it. And from this structure, we can then look at emergency hospital admissions and summarize when and where COVID was recorded for their like stay in hospital. So were people being admitted due to COVID? Was the admission like with COVID, but the main like clinical code was something else? Was it during their admission that they caught COVID? And like from an earlier day when like the clinical code, we were like having to work beyond the lag that we've got for the clinical coding. We also had this admission within 14 days of a positive test. So from knowing who is living in Wales, like when someone dies, if and when they got the vaccinations, and if and when they got COVID and whether they entered hospital, we can then start to kind of do these analyses we've been doing over effectiveness, safety, and uptake. Next slide, please. And just a gentle plug, if you want to know more about the data that's available, just check out the website. There's a much more comprehensive list of data sources. It also describes how SAIL works and how you can also apply to get access. But if you're feeling brave, you can also email directly either Ronan or Ashley. Thank you.
Great, thanks very much indeed, Stuart. SAIL is an absolutely fantastic data resource, not only for Wales, but I think for UK and international investigators as well. So thanks so much for that, Stu. So we'll go then finally to Northern Ireland.